having done this for 22 years and worked in from being a hired gun to owning my own facility to working in the state operations where I worked in public health, I kept looking for the right opportunities and the right options, and knowing that my ultimate vision was to have an operation where I ran things on my own. I got to a point in my life where I had reached a critical mass and I'd created this monster, so to speak, and I could not do all the things involved with marketing the practice and managing payroll and managing the day-to-day and staff who's not going to show up, and as well as training, because you got to have some systems in place to have a good, effective team. And I reached that critical mass of having to deal with those things to the point where I couldn't take it anymore. It was affecting my home life. It affected how I operated on a day-to-day basis, and I wasn't really there for what was most important to me was my family. Before Heartland, I worked 8 days a week, and Sunday afternoons I was in my office. I did a lot of marketing. Because of the services I provided, I had to be the go-to, as well as my own payroll and taxes, the whole 9 yards. It was my baby. Even though I had an office manager, but I still oversaw what was going on, and I wrote the checks. That's a full-time job, and then some. So it was 100 and 110%, and that's because I didn't have that balance, because my whole life and everything I committed to was, I was married. The best analogy I have for it is I was married to a monster. I had Frankenstein. Frankenstein being, you can't control it, but you can't get that far away from it either. And that's not a good place to be. It can drive you nuts. So 120% commitment to the practice, not enough commitment to other things that were equally as important. And I remember my son calling me one day on a Sunday afternoon when I was sitting up in the office, and he called me twice, and he kept calling over and over, and I said, "Man, what is it that you need?" And he said, "Dad, I just want to know when you're coming home." And that's around the same time I made that decision. I got to do something different than what I'm doing here. Ongoing and unswerving support for their day-to-day, with a commitment to knowing that you're the boss. You run things. You have total autonomy of what goes on in that practice. It gives you the security of knowing that you can work on a day-to-day basis and maintain your livelihood and maintain the livelihoods of your team and your staff, and continue to grow clinically as a provider. Because we always, as dentists, we're students of the profession. So we're continually evolving, continually learning, and it gives you leadership opportunities. I spent a lot of money on systems and training and practice management for my team, because I knew I could not, if I didn't grow them, I could not grow. From the standpoint of what they've learned, for example, learning how to know the business of dentistry. I knew the business of dentistry. I knew how to read a profit and loss statement. I knew how to read a P&L, and I knew the implications of how it affected the practice and how many checks I was going to write at the end of the week. But having my team understand that is something that I never had before, where they had that full understanding of how this place really operates and how it breathes. And when we have our meetings to talk about those things, it's really eye-opening to watch them actually take over the meeting and understand what they have to do to problem solve to make things go the right way. I talk about a lot of things when I do the communication courses that I facilitate with Heartland, and I talk about how I'm a very spiritual person. I'm a person that believes that things are divinely anointed and appointed, and there's a reason that things happen. People end up in your lives at a certain time. I know why I'm here, and I know what I'm doing. I know my purpose in what I'm doing. There's no greater place than I know of than working with Heartland Dental, and it's made me a better person. It's made me a better clinician, and I know it's bettered the lives of the folks who work with me on a day-to-day basis, and that's what I have to share.